This is now a COVID-19 update and yet another shocker that's coming from the national capital. We are once again reporting the highest ever single-day spike since the pandemic, and this time what has been reported in the past 24 hours is 6,700 plus. The Delhi Health Minister Satyendra Jain has now said that the national capital, yes, could be witnessing a third wave of COVID-19. This is something that they stated earlier last week as well. Now, the numbers that continue to rise, Health Minister Satyendra Jain further adds this could be because of more aggressive testing which is being done now by the Delhi government, and he's attributed the rapid spread of the virus to the festive season and to the dipping temperatures.
सर, क्या जिस तरह से मामले बढ़े हैं, पहली बार 6,000 से ऊपर गया है फिगर 24 घंटे में, क्या हम इसको दिल्ली में थर्ड वेव कोरोना की कह सकते हैं?
हाँ, कह सकते हैं, परंतु मेरा साथ साथ ये भी कहना है कि देखो, ये अभी जो पिछले 15 दिन से स्ट्रेटेजी को हमने बहुत फोकस किया है कि एग्रेसिव कॉन्टैक्ट ट्रेसिंग, जो भी एक पॉजिटिव आता है उसके जितने भी कॉन्टैक्ट्स हैं सबके टेस्ट किए जा रहे हैं, उसकी वजह से भी नंबर बढ़े हैं.
Our correspondent Ayushman getting us those details here. Ayushman, each time there is a record-breaking or an unprecedented 24-hour spike, it's a very predictable reaction that we get from the government or other officials here saying that this was expected because of the festive season, because of the onset of winters here. But the question here being, what can be done to rein in that spike? Because we are only midway through for the festive season.
Well, sir, there are two versions to this. The Delhi government says that due to the aggressive contact tracing, the numbers are increasing, but the center and in particular the experts say that the numbers are increasing because there is a festival season, there is a gathering that is taking place, and not to forget, the AQI index is very bad in the national capital. That is actually helping the respiratory problems to increase in the national capital. That is why we have seen more of the serious cases coming to the hospitals. So the Delhi government is still saying that aggressive contact tracing is the reason. But what needs to be done here, Sahar, is what the health ministry has been stressing upon for the past few days. They are saying that it is something called COVID appropriate behavior that has to be followed by people. When they are coming out, they need to wash their hands, maintain social distancing, and wear masks. This is something which you don't normally see in the markets, and that is the possible reason why you are witnessing a spike after every spike. Though the Delhi government can say it is first wave, second wave, third wave, the truth is that every time the cases go down, the government comes to claim the credit. But whenever it is up, they simply go on to say that because we are tracing more, we are getting more. The fact remains that not much what has to be done. The implementational theory on ground is actually missing. That is why we are witnessing a spike in the cases in the national capital.
Yes. And that's a major jump of what we're reporting now per day. Ayushman, thank you for getting us those details. And with these record-breaking numbers, the concern, of course, also is for hospital beds, ICU availability, ventilators, all of that now comes in as a top priority concern, to which with most ICU ventilator beds in Delhi's hospitals now occupied. This is what Delhi State Health Minister Satyendra Jain has further added on that the Delhi government will approach the Supreme Court to challenge the Delhi High Court's stay on having reserved 80% of the ICU beds for COVID patients in the national capital. It was on the 22nd of September that we'd heard this here, where the Delhi court had stayed the Delhi government's order to reserve 80% of private ICU beds for COVID just for Delhiites, calling it arbitrary and unreasonable.
Private hospitals के अंदर 80% बेड्स जो आईसीयू के थे रिजर्व किए थे, जिसको हाई कोर्ट ने रोक दिया था, उसके लिए हम अब सुप्रीम कोर्ट जा रहे हैं, ताकि क्योंकि अवेलेबिलिटी ऑफ आईसीयू बेड्स ही इशू है. आईसीयू बेड्स वैसे तो नॉर्मली 9,000 बेड हमारे पास अवेलेबल हैं, और आईसीयू बेड भी प्राइवेट हॉस्पिटल्स में दिक्कत आ रही है.